Okay, the meeting is now live, Chair.
Thank you. Good morning and welcome to the Primary Care Commissioning Committee meeting. I'm Margaret Carey, I'm a lay member, and I will be chairing the meeting today. We're meeting virtually in response to the limitations placed on governance by the COVID-19 pandemic. Members of the public have been invited to view this meeting via a link available from the NHS Portsmouth Clinical Commissioning Group website, and papers for the meeting are also available via this website. Today's meeting is being recorded so that in the event of a failure of technology, it can continue and will then be uploaded onto the NHS Portsmouth Clinical Commissioning Group website as soon as possible. Committee members and attendees are requested to keep their microphones on mute and only to turn them on when they are called to speak. Please use a raised hand to indicate when you wish to speak. Agenda items that require a decision will be confirmed by a raised hand by committee members only. Prior to presenting their agenda items, attendees should state their name and job title and, where possible, turn on their camera. Please, can everyone taking part today confirm that they are present? When I call your name, please turn on your microphone and give your name and title. So, can I call on Simon Cooper?
Simon Cooper, Director of Primary Care and Medicines Optimisation.
Julia O'Mara.
Good morning, Margaret. It's Julia O'Mara. I'm Registered General Nurse for the CCG in Primary Care.
Dr. Nick Moore.
Hi, I'm Nick Moore. I'm a GP on Portsmouth CCG.
Jackie Powell.
Morning, Jackie Powell, lay member. Thank you.
David Scarborough.
Good morning, I'm David Scarborough. I'm the CCG Practice Manager representative.
Andy Sylvester.
Excuse me, Chair. So Andy's just having IT problems trying to join the meeting. Thank you.
Okay, thank you. Michelle Spanley.
Morning, I'm Michelle Stanley. I'm the Chief Finance Officer.
Roger Batterbury.
Hello, Margaret and everyone else. I'm Roger Batterbury. I'm the Chairperson at Healthwatch Portsmouth.
Nicola Burnett.
Nicola will have sent her apologies, Margaret.
Okay. Claire Curry.
Hello, Claire Curry, Consultant in Public Health, Portsmouth City Council, and apologies from Helen Atkinson, Director of Public Health.
Thank you. Joe Hanspency. Lisa Harding.
Morning, Lisa Harding, Director of Primary Care for Wessex Local Medical Committee.
Christine Horan.
Morning, I'm Chris Warren, Primary Care Improvement Manager for Portsmouth CCJ.
Justina Jeffs.
Good morning, my name is Justina Jeffs, I'm the Head of Governance for the CCG.
Steve McGuinness.
Morning, Steve McGuinness, Head of Primary Care Commissioning for the CCG.
Stephen Arobia.
Morning, Stephen Arobio, Clinical Quality Manager for the CCG.
Rebecca Spandley.
Good morning. Yes, Rebecca Spandley, Finance Manager for Portsmouth CCG.
And Lisa Stray.
Lisa Stray for Business Services for taking minutes. Thank you.
And we've had apologies for Helen Atkinson, Jason Eastman, Joe York, Sylvia Macy, and Mark Compton. Can I ask, is there any new interest to be registered in the Register of Interest today? No. Is there anyone who needs to declare a conflict of interest today? Yes, that would be. Is that Dave?
It is, Margaret. As always on this meeting, the vast majority of the agenda, I have a conflict of interest because I work for a GP practice in the city. But in particular, item 7, the Guildhall Walk Health Centre update. My practice will undoubtedly pick up additional patients because of because of that closure. So I've got a conflict of interest from that perspective.
Okay. And Nick, is that you?
Yeah, basically much the same as Dave, apart from there's nothing very, very specific on this, but obviously as a practicing working GP at a local practice, obviously a lot of these agenda items would affect my practice as well.
Okay. Thank you. And those are not direct conflicts of interest, indirect ones, so that both will be allowed to take part in the discussion. Thank you. Can I now move to the minutes of the previous meeting?
Excuse me, Chair. Carol Giles has got her hand up. Thank you.
I can't see because there's the agenda's on the screen at the minute. I can't see Carol's hand. Sorry, Carol.
No, that's okay. Just really wanted to flag up that I'm here in attendance deputising for Johann Swenzel for NHS England.
Thank you. Okay, can I then move to the minutes of the previous meetings? Just to look at accuracy first. Page 1. Page 2. Page 3. Page 4. Page 5. Page 6. And page 7. And I think page 8 is very straightforward. If there are no accuracies to be made, can I take it that you accept the minutes and approve them? Thank you. Thank you very much. I'll take your silence as approval. Can I then move to the matters arising and locally commissioned services? Steve McInnes, do you want to say anything about those?
No, just to say we're still scoping out some of those services, Margaret, and you kindly agreed that I would come back at the next meeting with a full update, including the PMS reinvestment monies.
That's right. Okay, thank you. Justina, terms of reference? Sorry, Justina, are you on?
Apologies, Margaret, I'm having a few IT issues this morning. The terms of reference are currently under review based on some feedback we've had from some external consultants.
Okay, thank you. So will they be ready for the next meeting? Sorry, Justina.
Yes. Thank you.
Thank you. And the Guildhall Walk issues are on the agenda today, so we can move from them. Okay, can we move then to the next item on the agenda, which is the Primary Care Risk Register? And Steve.
I don't think that was my item today, Margaret.
Oh, is it not? Okay, right. Is there anything to add to the risk register? Any comments, queries? Are people happy as it stands? Jackie.
Sorry, Margaret, I just had a couple of queries really. One was about primary care transformation and the second about access to urgent care, where the scores seem low to me. I think they both come in at about 3 as an overall risk and green, and that I'm not sure what others thought, but it felt low to me. So happy for any feedback.
So any comments on that? Sorry, Stan, is there anybody from the team?
No, I think, access to urgent care, that doesn't feel like a situation where, it's so smoothed out, a score of 3 feels like where we're at. And the same with the transformation of primary care. There's been incredible work done, but again, it's part of a transformation. I don't think we're quite there yet.
So that does sound like a reasonably valid point. Can we?
So my understanding of the risk register is to look at the risk of this failing and going wrong, rather than a report of where we are. So the risk register can report on a process in terms of its way of going forward rather than the risk. So when there is an issue, it doesn't necessarily report on a risk register, and that might be where it's coming from.
Actually, there is something in that. The target risk is 3, and we're actually on 6 as a current risk. But it still feels a little bit. Maybe this is. I can have a word with someone behind the scenes or something like that.
We can review it and bring it back. We can review it and make sure that it is reflecting correctly where we think it is, and bring it back to the next meeting to say why those ones are scored particularly there.
Yeah. Justina, you had your hand up.
I was actually going to suggest the same thing as Simon, that we have a bit of a look at it in the round as well, and then bring it back with some further details of the scoring.
Yeah, because I mean, it does feel like a valid point that it wouldn't be most people's interpretation of a risk register. I would have suggested that some of your highest risks might have higher scores. Yeah. Okay. Can we then come back with that to the next meeting? Because this was looked at recently too, the risk register, wasn't it? Sorry, Andy Sylvester. Andy, you've got your hand up.
Thank you, Margaret. Sorry, yeah, the risk register. My thinking is the same around yours. I'm not sure what a target risk is meant to determine. A risk register is there to identify, your likelihoods of, etc. We're giving a score for that, but what's the target risk? It's surely not something we need to attain. It might be something. Is it something current? Is it something foreseeable? I'm a little bit lost with it. So would welcome, coming back to that, just a little bit more understanding. Thanks.
Okay. So we're going to bring back the risk register and explain some of the scores in a bit more detail next time. Is that okay? People happy with that? Yes. Okay.
Yes.
Sounds very helpful.
Any other queries or comments? No. Can we then move to the next item on the agenda, which is the primary care finance summary? Is that Rebecca?
Yes, indeed. Thank you, Margaret. Firstly, just a quick apologies. I'm having technical issues, so I can't put my camera on today. So sorry about that. First off, I just wanted to make a quick correction to the front sheet. People may have noticed it says the 21-22 draft financial position. That should be 2021. And the following finance paper notes the full year out term for primary care budgets for 2021, subject to audit. So we have completed the 2021 financial year. We're currently going through the audit process at the moment, and we're expecting that to be concluded in the next few weeks. So that's why we just have to note that this paper is just subject to the conclusion of that audit period. As the front sheet has explained, we've finished the year on a 541k surplus or benefit on primary care budgets, which has contributed to the CCG's overall 41k surplus position. I was going to keep my explanation sort of short and sweet, just to give anyone an opportunity to ask any questions on the finance report. Obviously, we brought the finance report to meetings previously and have noted throughout the year, because of COVID-19, we have enacted certain things like income protection for LCSs and the DESs, for example. But yes, I just wanted to invite anyone to ask any questions on the report on the full year out 10 for 2021.
Okay, thank you. Andy, you've got your hand up. Is that a happen?
Sorry, Margaret, that's a legacy, and apologies.
Okay, Jackie.
Hello. Just wanted some clarification on some of the underspends that we've got, and I suspect it's because it's COVID. So with like the leg group, LCS, the ear irrigation, and the flu incentive scheme. I was curious as to why the first two, I think I can kind of get why they're underspends, but the year of COVID and just how hard primary care has had to be focused on COVID, but the flu incentive scheme?
Yes, so with the leg group and the ear irrigation, so they would have been reflective of previous years' expenditure on those, where we applied income protection, but obviously COVID has had an impact on whether those schemes can actually go ahead this year, so that will have impacted on the actual expenditure actually spent in year on those schemes. And I have looked at the flu incentive scheme. I believe that's been picked up in another line in error. I think it's gone into other in delegated commissioning. So I apologise for that, but that has been picked up, and I know we have commissioned a flu incentive scheme in year.
Oh, thank you very much. That's helpful.
That's okay, no problem.
Any other questions or queries? Carol?
Yeah, really just following up on the leg ulcer, Les. I would have thought these patients would have still been having ongoing care throughout COVID, although I appreciate that access is not quite so easy during the pandemic, so you'd expect a bit of a drop. Just wondering why that is, that the spend was so low.
Sorry, was that the leg ulcer?
Leg ulcer, Les, that you picked up on, Jackie?
Oh, it was the leg group.
Oh, right. Sorry, I misunderstood.
Apologies. No, that's
I thought it was
not
leg ulcer care. I'd say those patients surely are being receiving continuing care anyway.
Yes, absolutely. And I believe that is the case. And we do have a separate leg group LCS commissioned under our reinvestment of PMS premium, which has just seen an impact on actually having that leg group go ahead in year.
Okay, thank you.
Any other questions or comments on the findings? Is there, I mean, an underspend presumably is welcome in some ways, but there are issues about that around what we haven't invested in primary care, which I assume people are mindful of and all that. Is that simply down to COVID? Or
there will be impacts of COVID, of course. We had some investments in year through non-recurrent funding streams that came through very late. It then becomes quite difficult to commission against those pots of funding. And then with the delegated commissioning, that's very much a structured scheme and reimbursed on the national contract, but is also dependent on whether certain items of expenditure come through. So, for example, we might have fluctuations in maternity and sicknesses we have during the year, and that affects how much we actually physically spend. And then we do set aside a contingency in that budget, which for the main part we haven't had to utilise in year. So there will be fluctuations for other reasons other than COVID.
Okay. Just something to watch in terms of what we invest in primary care and given the position of primary care at the minute. Yeah, just concern. Okay, can I move then to flu and vaccination programmes update? I think that's Simon.
My life is vaccinations currently. Currently we are obviously into May, so flu is currently taking a back step, but will raise its head fairly soon. In terms of COVID, we are still all steams ahead with the 5 LVS vaccination centres we have in Portsmouth and the 2 community pharmacies and the vaccination centre on the St James's site. So we have around about, for the cohorts 1 to 9, which were the priority cohorts, we are looking at somewhere around nearly 90% of those patients have been vaccinated for their first vaccination, and we're going through the second vaccinations now, and we are up at over 60% of the second vaccinations have gone through. So we are, compared to Hampshire and Isle of Wight, we are at or about the same level. And that's probably down to the way that we're managing our allocation of vaccines equitably across Hampshire and Isle of Wight, and we're working very closely with the rest of the team. So it's not a huge huge surprise that we are actually about the rest of Hampshire. Moving on to cohort 10, which was the next cohort, we are up at just over 70%. We are seeing an increased hesitancy in some of these groups, whether that was always there or whether that coincided with the moving into cohort 10 with the AstraZeneca issues regarding embolisms, and that increased the hesitancy. We don't know, but we are working very closely with Public Health and the Council to identify communities and cohorts where there is low uptake, and we've already worked with them in terms of looking at the homeless, and we've worked with the one of the mosques in Portsmouth to pick up increased vaccination rates. And there are some knock-ons in terms of not just around vaccinations, but engaging with these cohorts in terms of wider healthcare services going on by just improving those relationships and that trust between some of these cohorts. And the data that we've had in terms of some of these patients being brought in who were previously hesitant have shared with us that are more willing to actually engage with healthcare services across the city. So it isn't just about COVID. We're taking that opportunity of contact to actually build trust with communities. Still lots of work to be done in terms of some of the cohorts who are more hesitant, and again working very closely. The council have been fantastic, Public Health and the council, in terms of linking in with some of the key leaders in these communities, and actually starting to improve those vaccination rates. So that's really good. Most recent change to the vaccination centres is, you've heard, with the extension of the expiry date for the Pfizer vaccine. So that going from a 5-day expiry date at normal fridge temperatures, 2 to 8 degrees, to a 31-day expiry date, gives the vaccination sites rather the ability to find those patients and manage those vaccination centres much easier. There isn't the panic if you're going through a vaccination service on the day and you find 10 people don't turn up, that you've got a few hours to find 10 people, very short notice, to come in and get vaccinated. That allows that to be done a little bit easier the following day, and you can go and find those patients. So we're not panicking to actually go and grab people last minute. So that makes things much easier for not only for the practices, but for the patients as well to access it, because a day later isn't going to make any difference. But it also takes some of the strain, as we move into these extended life, takes some of the strains off the admin staff in the practices in terms of trying to grab these people. So hopefully, as that comes into the system, it will make things much easier. And we don't know where we are yet in terms of it might make some changes and might make some easier access on the supply chain, in terms of they could supply larger amounts if they do have larger amounts, and subsequently, rather than have small amounts regularly to a small number of vaccine sites, we could have larger, less frequent deliveries and potentially have more vaccine sites, so practices can work on road. So that's our hope. We've yet to have that confirmed coming down, because we're nowhere near that yet currently, but it will make things a lot easier going forwards. And I think as we get into the booster season, I think there's a potential for that to happen, so fingers crossed on that one. The only other change that we have is that we have one of our PCN sites is moving on to and started using the national booking system. So that's one of the 2 sites across Hampshire and Isle of Wight. They're currently doing their own local booking system and the national booking system. It is a change in how they work, so we need to rather than a big jump and a flick of switch to the national booking system, it's a bit of an evolution, slight change in working. We had some feedback on Tuesday on how that's working, and overall they are positive, but still need to work a few things out. They have said that through the clinics they set up through the national booking system, they do tend to see a greater non-attendance rate, a greater DNA rate for those. So it'll be interesting to see why that is, whether it is people that are booking and then deciding not to attend, or whether they are booking through the national booking system and then subsequently booking somewhere else and forgetting to cancel one of those other appointments. but until we've worked through that, we won't be able to see a lot of that. But it's an interesting step forward, because I think the biggest concern around the vaccination centres now is the drain on the resource of the staff that are doing this. It's been going on for a long time, and we need to make it as efficient as possible. As we start to work through summer, as we get staff going on, hopefully some holidays, we're going to reduce the resource, and then as we come back from that, we're going to be very quickly into the flu season again, and running that alongside a COVID booster clinics will again start to take the toll on the resources. So we need to have this as efficient as it can be. And I think that's probably it where I'm at the minute for COVID, if there are any questions.
Roger.
Yeah, just a comment and a question, if I can, Simon. Great that the engagement with communities is going to be ongoing, because that seems a wonderful opportunity to keep people engaged with healthcare and social care. So that's good. My question is that we'd heard at Healthwatch, and I'm reading it from my little phone. There was an issue with IT on the 23rd of February. Someone had their COVID jab at Eastney Health Centre, and there was, all they say is there was a computer glitch while I was there at 8:50 a.m., which meant everything was done on paper, and my practice wasn't notified that I'd had the COVID vaccination, so hasn't called me for my second one, which is now due. The patients with the Craneswater group practice, and there were other people there at the same time. So just sort of flagging it up, really, that clearly some people. So I don't know if this has been a theme or just System 1 crashed.
No, it wasn't System 1, because we're not using System 1 for the COVID vaccination. So it's a system that's run by a company called Pinnacle, that is the one that's being used by all of the LVS centres. That would have been during the very early days when it started up, and I think it was a bit of a victim of its own success in terms of the number of people that were using it. There were periods initially when it went down. I think from memory, it only went down for 30 minutes, an hour or so, until people could get back in. So the process was that the vaccination clinics went to a paper copy of that screen, which is effectively a tick box screen that you run through, that you've done all these bits and pieces and to record it. So they went to a paper system, but once it was back up, you could then put those back in at that point in time. So they should have been put back in. So whether that individual issue was around a particular issue with the IT, or whether it was a piece of paper that got stuck to the back of another one and didn't get picked up, I don't know. Or whether it was just human error at that point in time. I mean, we've done approaching, I guess we are, I mean, the figures I've got is we're probably coming close to 180, 190,000 vaccinations when you count first and second vaccinations for patients in Portsmouth. I have had one or two that have missed out or fallen through a net for whatever reason. The only advice I can say is if you do have a concern that you've got to what is now the 8-week time limit and haven't been called back in, just flag it to the practice to say, I was expecting the call now. Clinically, the difference between 8 weeks and 8.5 weeks or 9 weeks is limited. But yeah, there is the potential for incredibly rarely, so this will be what, 1 in 200,000 is just make sure you get picked up. I don't
Sounds
think
like there was a batch of people that were experienced the IT glitch. Obviously, this person put pen to paper because they'd found that they weren't on the system. So we're do the feedback as you said, Simon. Yeah. Thank you. It was just sort of mentioning it because it had been flagged up to us.
I do get an occasional patient come through the CCG inquiries inbox to just ask for some queries, because what we've got is we've got obviously a national service to vaccinate as many people in the country as we can. So to get those patients through, we have to run pretty much a military exercise to get people through and get them through. There will always be people that for whatever reason don't quite fit, and they can come through the inquiries line, or depending if generally their practices know about those and can pull them out, but occasionally we'll get some queries through. Largely, it's very small. It's quite a nice opportunity sometimes for me to go and talk to a patient, which I quite like. I don't get that opportunity as much as I used to these days, and I've done that. And generally, where I've spoken to those and explain the situation, they can understand it, so they then have the skill set to go and actually put themselves in the right place. And it's been quite useful, I think, for me to understand it and for those patients.
Lovely. Thank you very much, Simon.
Can I bring Dave in here, because I think you've had your hand up for a while. Is it related to this issue, Dave?
It is indeed, yeah, and first of all, Roger, thank you for bringing that to our attention. But I would certainly say, in the first instance, and to the person who's been affected by that, I would really encourage them to go back to the practice in the first instance and ask why they haven't been called for their second vaccination. My other point is, yes, with the introduction of the systems around the COVID vaccinations, we're having to work off not just one system, but 3 different systems to deliver this vaccination programme. And whilst I'm saddened by somebody who may have been missed for recall, I just want to emphasise how hard, and I know firsthand how hard those vaccination centres are working alongside doing everything else they're doing in primary care at the moment. So, and just to echo absolutely everything that Simon says, it may well the system was there. We have had some problems with it, but they seem to have been ironed out more recently, so the system is working better. And yeah, I just encourage that patient to contact their practice. And just my final point is that whilst they're going to Eastney Health Centre, it does sound like that was a Cranes Water practice. So they actually need to go back to their parent practice, because, there's 2 practices out of Eastney Health Centre delivering those vaccinations. So it is the respective teams, it's the logistics around the vaccination programme that means we're limited to what sites we can do it at. Thank you.
Dave, will do. And can I just read, the person was kind of passing it on for information and to make others aware. What the lady said was, also to be clear, there is no criticism of the staff, as they did a fantastic job. I just wanted to pass on information. So just to say that.
Thank you. That's very nice to hear. And we've had a huge amount of very positive feedback around these vaccination clinics. Thank you.
Yes, and I think the criticism I heard was of the systems, not the staff. Okay. Any other questions or queries on vaccinations for Simon? No? Okay. Can we then move to Guildhall Walk Healthcare Centre? And Simon, I think that's yours again.
Well, that's me this morning, Margaret.
Yeah.
Thanks.
Okay.
So Guildhall Walk closure. I think last committee meeting Simon gave a lot of the background and context to the closure of the practice, and hopefully today's paper kind of sets out and summarises all the various activities that are being undertaken in regard to the project. So I won't spend too long talking, but I'll just briefly cover off the patient engagement and service continuity aspects, which I know are really important. So just to do a bit of a recap, patients received a letter initially, just informing them about the closure, and then we followed that up with a second letter inviting them to some engagement events, which obviously we had to hold online, unfortunately, not as good as doing face-to-face, but still they worked pretty well actually. And we had around 50 patients join 3 sessions in total, so not masses of people, but there were some good questions asked, which we were able to respond to, and it helped our line of thinking to a degree as well in our future communications. So that was really good. And then we sent out a third letter to patients a couple of weeks ago, asking them to tell us their choice of new practice that they would like to move to. And that was quite a detailed piece of work. We originally went through all the practice boundaries in the city and made sure that they were accurate, and we agreed them with the practices. We then worked with our commissioning support unit, and they did a bit of work around mapping that out as precisely as possible, so that when the letters went out to the patients, they were only getting the choice of practice for those practices whose boundary they fall within. So we're doing this in as managed a way as possible. I think it's the first time the CSU has done this in this way, to this level of detail, so it's worked really well so far. We've only had under 1,000 survey results back so far, and bearing in mind there's about 8,500 patients, not a great number of responses so far. So we're hoping to send out a text reminder today to all the patients, just to encourage them to make their choice online. They can also contact the CCG, and we will do it on their behalf if they can't get online as well. And we're going to extend the deadline slightly as well. So the deadline was next Monday. We're going to give people a few extra days as well to try and get those choices in. But of course, anyone that doesn't make a choice, we will make sure they're allocated to a practice. And we did put that in the letter. So whether some people just feel they'll leave it to us to do, and that's why they're not responding, that could be the case. But we'll obviously see what else comes in over the next few days. We're also getting lots of return mail as well, so that's a process we're following through. So we're taking that over to the Guildhall Walk surgery for them to then follow their due process for return mail, and try and see whether these patients actually have long ago moved somewhere else, or whether there's a change of address they're not aware of. So there's lots of sort of issues that we're following up with around that. And then over the next few weeks, we'll do that analysis of which practices the patients have chosen. And see if we can give them, we're hoping to give everyone their first choice, but obviously it would depend on the capacity of the practices in the city. And we've set up some meetings with practices later in June just to go through what the numbers look like and have those discussions around what is feasible for them to take on in terms of patient numbers, and do that matching exercise. We are getting quite a few emails into our generic mailbox. We've set up an account especially for patients to contact us, so we're dealing with various queries coming in on that. And I know our business services team are doing a great job as well, taking some phone calls from patients, and also the local authority front desk helping people do their surveys where they can't do it themselves online. So it's a real team effort involved, really. Moving on to service continuity. We are making sure that the Guildhall Walk practice are flagging up patients. Two main things there. One is people that may be vulnerable and might need a tailored letter when we confirm which practice they're going to, and a bit of extra support. So it could be people with learning disabilities and other vulnerable patients, homeless patients, for example. And then secondly, there's a group of patients that will have some ongoing health needs. And we're just making sure they're flagged as well to the new receiving practice. So it could be something like somebody's having regular wound dressings, and we just want to make sure that the new practice doesn't lose sight of that. And if they're having twice weekly dressings, that continues as soon as they move practice. So we're working very closely with the practice around that. As I say, we've got meetings set up with the receiving practices in the next few weeks. Homeless service is being scoped out, as you know, still ongoing discussions around that, but we have identified 3 practices within a PCN which we can register Guildhall Walk homeless patients to, and that will tie in with the homeless outreach service, so we're working on that. And finally, just to say regarding the special allocation scheme for patients which we have in the city, we've progressed some talks with a provider to deliver that for us in the future, and that's across most of Hampshire and Isle of Wight. So not Southampton, because they have a separate service, but most localities within Hampshire and Isle of Wight have come together, and we're just starting to make progress with that to start hopefully from 1st of September. So I think I'll probably stop there and just see if there are any questions or comments.
Cameron, you have a question?
Yes, I do, thanks. So Steve, you've got on the timetable that the patient transfer process will run from the 1st of July through to the 31st of August. How is that running? Are you sort of moving patients in batches during the course of that 2 months?
Yeah, we've had discussions with Primary Care Support England and System 1, as well as the CSU, and the plan is to do some bulk transfers for probably at least 4 of the practices where we've got masses of patients probably going to go to those practices.
Yeah.
So we'll do a bulk transfer for those. For some of the other practices, probably a bulk transfer wouldn't be the right answer because there's quite a large cost involved for one thing. So we would probably ask practices to manually register those. But we also have drafted up a support resilience scheme for the receiving practices. It hasn't quite been finalised, but the aim of that will be to support those practices in taking on the new patients.
Yeah, okay, thank you. There was another question. It's gone for a minute, but we will come back.
We'll come back. Are there any other questions? Jackie?
Thank you. Steve, actually, you answered most of mine about the special allocations and scope for homeless, and hopefully that seems like it's progressed and will be on time. I didn't understand a bit around the safe space though and what our plans are for that. I might have missed it.
Yes, there are ongoing discussions around safe space, Jackie. I'm not personally leading on that one. One of my colleagues in another team is. I can't quite remember where that one got to, but I know she has progressed the talks around safe space in terms of trying to find another site. So I think those discussions are ongoing, but certainly a lot of progress has been made.
Okay, I just don't want to lose sight of that one.
Yes, I'll be happy to report back next month on further progress.
Perfect, thank you.
Thank you. Nick?
Yeah, just quickly following up about the special allocation service. So obviously there's been discussions about where that's going to be, presuming that we're going to have something that's going to be provided within the city, because obviously you're talking about a wider coverage across a wider patch, but presumably we're going to retain provision within the city of Portsmouth, are we, for that?
Yeah, I think the aim, Nick, is to go more down the digital route where we can, but clearly there will still need to be an element of face-to-face to it. So the provider that has expressed an interest is looking at having possibly 1 or 2 strategic sites or possibly 3 sites that they can use as necessary, and hopefully one of those will be local to us.
I thought just impact on these patients, because obviously they may present a challenge, and obviously having to travel is not going to, if it's a long way away, that could be a challenge. So that's good to know. Thank you.
Okay. Back to Carol.
Yeah, sorry, it's come back to me now. GP to GP. Some practices have experienced difficulties with bulk transfers in that they cannot immediately access patient records because GP to GP hasn't worked. Have you talked that through? I'm just flagging it up as a risk really that might need to be addressed with System 1 and PCSE, just to ensure that works on the day.
Okay, thanks, Carol. Useful to know. When we have our next meeting with TPP System 1, we'll discuss that, and obviously we want to make it as smooth as we possibly can. So I'll involve a couple of local practice managers in that as well to make sure we're all happy.
Yeah, I would talk to Keighley as well because they've been through a similar process over there.
Yes, we've talked to them on a few different things, so I'll raise that with them as well.
Ideas.
Yeah, thanks.
Thanks.
Any other questions or comments on the Guildhall Walk position? Simon?
Just one comment as being a relatively new director of primary care. Just for my don't shake your hand. I'm gonna shake your head. I'm gonna keep saying I'm a new director of primary care until somebody says I can't get away from it. I want that honeymoon as long as possible. No, just to say how efficient that Steve has led this piece of work through, and how it. And I don't want to jinx anything yet. We're not home and dry, but Steve has covered everything to date. It's working really efficiently, and I think that was probably demonstrated most to me with the 3 engagement events with the patients where Joe York, myself and Steve were presenting. We could answer all of their questions within reason. There are a couple of little bits and pieces that we need to pick up and take away for some specific patients. but I don't recall the last time I had 3 meetings where we got a round of applause from the patients in terms of sharing the information and being open with them. So I think this is as far as I can see from my position to date, this has been a textbook piece of work. You can never expect it to be perfect, but it's been picked up and run brilliantly by Steve and the team. So thank you very much for him.
Thank you. Okay, so thanks, Steve. Well done. Can I just summarise? I think there's some issues about the safe space issue, and that's going to come back to the next meeting. Oh, excuse me. While I choke. The next meeting. Sorry. There are also issues about GP communication which need to be picked up. And you've had some reassurance about the coverage of homelessness. Okay. And so thank you very much, Steve, for that, and well done. Can I then move to any other business? Is there anybody with any other business? No. The date of the next meeting then, and I've failed miserably to keep to the timetable. So I'm not sure about its value, but we'll have to look at that again. Can I say the next meeting is the 29th of July at 9:30, and we'll still be on Teams, I think, at that stage. Okay, thank you very much. Thanks for your attendance, and see you next time.
Thank you. Bye.
Thank you.
Bye.
Hi, everyone. Thanks, Margaret.
Can
Thanks,
we
Margaret.
turn off the public meeting then? Jane, are you there?